Hello, my name is Rebecca Weimer, and I'll be discussing Parkinson's disease for BIO362, fall semester 2025. So, what is Parkinson's disease? It is classified as a neurodegenerative disease marked by the death of dopamine neurons in the substantia nigra. The substantia nigra is Latin for black substance, and I included an image on the left here to show you that this black substance in the substantia nigra is typically pretty dark in healthy individuals, but very diminished in Parkinson's patients. It affects about 1 million people in the US. People typically develop it in their 60s or 70s, and it is marked by symptoms as tremor, slowness of movement, known as bradykinesia, limb stiffness, known as rigidity, and gait or balance problems. There are multiple risk factors like genetics, environmental factors, age, and lifestyle. So, how does Parkinson's affect the brain and body? In a normal person, the nigrostriatal pathway involves dopamine projecting from the substantia nigra to the striatum, the thalamus, and then motor cortex. When there's a loss of these dopamine neurons or death in this pathway, that's when we can expect to see negative impacts in motor control. And that's why a lot of Parkinson's patients report slowness of movement, slowness or stiffness in their muscles and also limbs, gait problems, sometimes tremor, and then in later advanced stages of the disease, cognitive deficits. Parkinson's can be diagnosed in two ways. There's a clinical tool called the UPDRS, the Unified Parkinson's Disease Rating Scale. It has 4 domains that look at memory, daily living, motor, and motor complications. On the right, I included a picture from the actual UPDRS that is looking at freezing in Parkinson's patients. Freezing is when people feel like their feet are stuck to the floor, and it can be rated in a variety of ways to help the clinician understand the severity of the disease. There is also the DAT scan, known as the dopamine transporter scan, that uses a radioactive tracer to bind to dopamine in the brain. In healthy individuals, dopamine is usually marked by this kind of comma shape that you'll see in the bottom picture on the left. And then in people with Parkinson's, they have a loss of these dopamine neurons and they have a more period shape. It is commonly used for early diagnosis as well as confirmation of the disease, just to make sure that it's not some other type of movement disorder. Parkinson's is typically diagnosed in older individuals from 60 to 70, but people under the age of 50 can also be diagnosed, known as young onset, or in older populations like 80 and up, also known as late onset. Men are more likely to be diagnosed than women. People who have family members like siblings or parents are 2 times as likely to develop the disease. Research is showing that environmental factors like farming chemicals, Agent Orange, heavy metals, or detergent and solvents increase the risk of Parkinson's. Past history of head trauma, and in the US, white communities are more commonly diagnosed with Parkinson's, but research is still trying to understand these racial disparities to better serve the community. Parkinson's can be treated in a variety of ways. Most commonly, drugs, known as carbidopa, levodopa, or the different varieties of it, are used to deliver the precursor to dopamine, known as L-dopa, into the brain, and it crosses the blood-brain barrier to deliver or replenish the brain supply of dopamine. Exercise also is great in helping reduce or slow the progression of the disease. It is commonly recommended to also limit alcohol intake, try and eat healthier foods, increase your amount of sleep, and also reduce exposure to harmful chemicals. People living with Parkinson's commonly report limited mobility, especially as the disease progresses. So they're given referrals for specialties like PT, OT, or speech therapy. Speech therapy mainly because voice volume can decrease with the disease. There's also public embarrassment due to the tremors or dyskinesias. Dyskinesias are this involuntary, constant movement. If you've ever seen a clip of Michael J. Fox, you'll see that he's constantly moving around, and that's due to the medication that he's taking. There's also negative impacts on quality of life, changes to thinking and memory, such as memory loss, hallucinations due to the medication, or issues with impulse control. And all these symptoms can have a negative impact on mood, increasing people's susceptibility to depression or anxiety. Parkinson's prevention is still being researched, but people who smoke are less likely to develop Parkinson's, but it is unclear whether people who have Parkinson's are less likely to become addicted to nicotine products or some other biological processes happening. Exercise is commonly recommended because it can be neuroprotective or slow the development of the disease and also helps maintain muscle strength. Getting good sleep hygiene is also important because a lot of reparative processes happen while we sleep. Eating a nutritious diet like the Mediterranean diet, which has a lot of nuts and grains in it, or eating low processed foods can also help slow the progression of the disease. And similar to smoking, tea and coffee drinkers are less likely to develop Parkinson's, but again, we're just not sure if that's because Parkinson's patients have a less affinity to, regularly drink caffeine-containing beverages. There are several other therapies that are used to treat Parkinson's, like DBS, deep brain stimulation. It is a surgery where an electrode is placed into an area of the brain, and then when people come in for their doctor's appointments, they're given some type of programming which essentially shocks or stimulates this area of the brain to reduce the tremor in real time or improve movement. There's also focused ultrasound that uses an MRI to destroy these areas of neurons that aren't properly working. However, it is irreversible. And recently, there's been a new drug that uses dopamine pumps to continuously deliver the medication to individuals to help with their movement and overall quality of life. And it's inserted just underneath the skin. These are my sources for my presentation. Thank you so much.